Hello, my name's Dr. Seb Gray. I'm a paediatric consultant in Salisbury with a specialist interest in asthma. Persuading children and young people to take inhalers is quite a broad subject and quite challenging. There are two main groups that this affects. Firstly, you have the really young children on inhalers who may well have been started on these inhalers following a traumatic admission to hospital where they potentially required needles or blood tests, and they associate their inhalers with this. Trying to pin them down and give them inhalers is notoriously challenging, but can be relieved or made a bit easier by making it into more of a game. You can put stickers on the spacer devices, for example, or put them with their toys, do role play, things like that, where it takes away the trauma association with that. Developing a technique where you can administer the inhalers as quickly and as efficiently as possible is also important. And we have links on our Healthier Together information leaflets on inhaler technique on how to best do this. The other thing is that some small children actually will never get on with inhalers, and they really, really struggle with them until they're developmentally old enough to negotiate and use things like sticker charts and reward systems with them. In that case, it's worth speaking to your asthma nurse, your GP, or your paediatrician about whether something like Montelukast, an oral medication, may be beneficial. They will talk to you about the risks and side effects associated with this, but it might be worth considering if you really are struggling with a small child and inhalers. The second group where we often find young people not taking their inhalers is the adolescent age group. It's perfectly and completely natural to go through a period of questioning and potential non-compliance with treatments during the adolescence period. During this period, it's really important that we respect these young people and the changes they're going through, but try to inform them of the benefits of taking their particularly preventative inhalers and what benefit this can have for their long-term health. To do this, we need to empower them. And this can mean choosing a different inhaler that they get on best with, or switching over, if they're old enough, to something called the MART regime, the maintenance and reliever therapy regime, which gives them more power and control over their asthma control, and hopefully helps them feel more empowered rather than us telling them what to do, them feeling like they're looking after their own health and doing what's best for them. Both groups can be particularly challenging and both need to be catered for actual individuals, and it's not one size fits all. So getting to know the young people and the families can really help in this situation. Steroids, like any medication, do come with side effects and some risks. Most people are really worried about taking a steroid inhaler on a daily basis, but actually, particularly with small children, taking short courses of oral steroids can have more side effects than taking an inhaled low-dose corticosteroid on a daily basis. For example, 3 or more courses of oral steroids in the preschool, so under 5 age group, doubles your risk of having a fracture of your humerus in the next year. And that's quite scary. The same is not true of taking regular inhaled corticosteroids because often the doses are extremely low. Long term, there can be some effects on growth, but actually not having well-controlled asthma will affect your growth much worse than taking a low-dose inhaled corticosteroid. The other short-term side effect that we see is the effect it has on the mouth after taking inhaled steroids. And it's really important to try and brush your teeth or at least rinse your mouth out with water after taking inhaled steroids, because it can cause some oral thrush, which can be easily avoided. Pets often get blamed for being potential triggers of asthma, and some obviously are. Sometimes it can't be as clear cut, and so some allergy testing may be required to see if your pet cat or pet dog or other animals may be triggering asthma attacks in your child or young person. These tests could be skin prick testing, involving small pricks on the forearms of your child and seeing if their skin reacts, or it could be a blood test looking specifically whether the blood reacts to that particular animal. Neither of these are specific tests to seeing whether you have an asthma attack related to that animal. So they're not 100% guaranteed, but they do give clues and indications. Sometimes, if you're really not sure, it might be worth doing a trial away from that particular animal to see whether your child's asthma symptoms improved. We certainly wouldn't recommend culling or getting rid of animals at the off chance that they might be allergic, and particularly when they're well-loved family pets. It's worth exploring in a lot more detail, but this is something you can speak to more about with your asthma nurse, your GP, or your paediatrician. Smoking outside or away from a child is undoubtedly better than smoking in their immediate vicinity or just next to them. However, it still unfortunately has negative effects on your child. They're twice as likely to be admitted to hospital. And unfortunately, they're 3 times more likely to get lung cancer in later life if you smoke, even if it's not around them. The smoke, ultrafine particles stick to your hair, your skin, your clothes, your breath carrying on for a long time afterwards. And so the effects do carry on. We know it's really, really difficult to give up smoking, but that's why there's so many support services available. And if you do really want to give up, get in touch with your GP or one of the many helplines available on the internet. We know that vaping is one of these options that is offered, but we also know that nicotine is contained in most vaping or e-cigarette versions, which also comes with its own side effects. Nicotine, for example, in itself, without the products from the actual cigarettes, can reduce the effect of steroids. So exposing your child to that secondhand should be avoided at all costs as well. The same applies for vaping as it does for smoking. Try to avoid doing it around your child as much as possible and ideally stop altogether. We know how difficult it is, but our advice would be don't stop giving up. Children and young people spend a significant amount of time in school or educational settings, and so it's really important that they know about your child's asthma and they know what to do should they have an asthma attack whilst they're at school. Sharing their personalised asthma action plan is strongly encouraged so they know exactly what to do and they have the exact same signposts to resources that you do. This means things like inhaler technique and when to call for help on how to treat acute exacerbations that require potential hospital admission. The most important thing is to share their personalised asthma action plan. And if they need more education or help, again, direct them towards the asthma nurse attached to your GP practice and the Heathier Together website. Physical activity is great for children and young people. The national recommendations are doing an hour of physical activity every day to get you breathless. This becomes particularly challenging with asthmatics, as sometimes it can be difficult to tell whether breathlessness is due to their asthma or just to natural exhaustion due to exercising sufficiently. We want our children to be healthy moving forward, and exercise is good for asthmatics. It builds on lung function and improves the long-term quality of life and cardiovascular function, leading to healthier lives in the future. However, their asthma has to be well controlled for this to be the case. Children sometimes need some salbutamol if they're really struggling with breathlessness and wheeze associated with exercise. Again, if this is happening 3 or more times per week, then their regular preventative treatment may need to be increased, and you'll need to make an appointment with your asthma nurse, GP, or paediatrician. Some children benefit from taking a couple of puffs of their reliever treatment, salbutamol, just before they do exercise. It's really important this is done through a spacer, and we know there can be stigma associated with carrying around a spacer. But until children are old enough to use breath-activated devices, carrying a metered dose inhaler with a spacer and using this before exercise is the best way to deliver the drug. Unfortunately, yes, where you live does affect your asthma. We know that poor air quality has a significant impact on asthmatics, with 1 in 5 exacerbations being admitted to hospital being attributed to poor air quality or air pollution. And 2/3 of asthmatics saying that poor air quality makes their asthma worse. However, there are a few things that can be done to try and minimize the effect of air quality and where you live on your asthma. Firstly, the air quality varies on a daily basis to the point that they have a daily air quality index, DAQI or DAQI. This ranges from 1 to 10, with 1 being really good air quality and 10 being the worst. And you can plan what you do on a daily basis based on this air quality index, because actually if the air quality index is really bad, so the higher numbers, then you should try to avoid doing too much exercise or activity outdoors, as it's likely this will cause exacerbations of your asthma. This can be checked on all weather apps on smartphones and found on the internet. So it's a really handy, useful thing for asthmatics to check so they can adjust what they do on a daily basis. Secondly, air quality also varies geographically, being particularly bad in built-up urban areas. Simple things like avoiding smoky areas, so wood burners, barbecues, industrial areas, busy roads, coach and bus stations can all be done to try and reduce things as much as possible. We also know pragmatically it's not always possible to avoid busy roads, so walking furthest away from the roads can be a simple step that might help. Finally, everyone with asthma should have a personalised asthma action plan, and this should tell you or remind you what you should be doing on a regular basis. Your preventative treatment should stop you from having asthma exacerbations, and you should be carrying around a reliever treatment. If you're needing this reliever treatment, which is often a blue salbutamol inhaler, then actually if you're needing this 3 or 4 more times a week, then it's very, very likely you're going to need to increase your preventative treatment. By sticking to that treatment, we really can tell whether this is required or not. And if it is, then it's worth making an appointment with your asthma nurse, your GP, or your paediatric team at the hospital. Because the NHS can't afford to move everyone out to the countryside or to the by the beach to improve air quality. But actually, by sticking to some of the basic things, we can do our best to help until hopefully the environment changes and air quality in general improves.